We're gonna do this together. We're gonna play Eric Garcetti, the mayor of Los Angeles, his live stream. Informational for everybody. I'm gonna take notes. I'm gonna be here. I'm gonna be sitting right here, taking notes with y'all. You won't see me. You might hear me. You might hear me a little bit, but I'll be right here. Why New York City is out. Hey, I got some info actually on New York City. If you want, I can share it with you right now. You guys want me to do that? Should I share information about New York that I wrote down? I wrote down a whole bunch of information. I could do that right now, or I could do that. I might as well just do that shit now, huh? I feel like I should do that now. Alright, hold on. So New York is on a crazy path right now, everybody. It's 2 weeks behind Washington. Where is it? That's not the right one. It's also not the right one. Also not the right page. Lord's sake. Okay. So. Hola, ¿cómo estás? Okay, so clinical trials in New York are going to begin for existing drugs that may help against the virus. So you guys might have heard this stuff about a pharmaceutical drug called chloroquine and hydroxy, and what they are used is to fight malaria. And so they are using a combination of chloroquine and hydroxy and Z-Packs. Z-Packs are what are used like as antibiotics when you're like super sick. They have them in other countries. They're harder to find in America. But so they're using the two malaria drugs mixed with Z-Packs, and it's looking very promising, and they're going to distribute 10,000 doses tomorrow in New York City and New York State. And they worked with the FDA to get that approved, which was not easy because the FDA has to go through an entire process before they approve treatment. It's protocol, so they pushed that through. The government did, which is awesome. There was a guy who was dying. His family said goodbye to him. He was like on his deathbed. They all said goodbye. He went to sleep, and then he woke up, and he apparently survived. And then he went back. He felt better, and then he went to sleep, and then he woke up again. He felt even better, and he's recovering. So it's promising. Who knows if we don't know if we're still testing it, right? It's not approved, but it seems to be a positive thing. There's a new self-swabbing test kit on the way that's far less invasive. Yeah, New York is under a lot of stress right now, that's for sure. There's FEMA is an organization. If you don't know who they are, you don't have to know exactly who they are. But what they do, things like distributing 8 million N95 ventilator masks. My source for this about the medicine was the White House's update today, earlier on. It was on Fox, but it was from Trump's mouth, and what's her name? I forgot her name. I think she works with the World Health Organization. So it's from the federal government. This is what they said, and I heard it, not live, but I watched it back. There's self-swabbing test kits that are less invasive right now. If you want to get tested to have COVID-19, there are no vaccines. Let that be known. There's no cure and there's no vaccines. We don't know that. So if anyone's trying to tell you that there is, they're probably lying to you. Or there might be that are like naturopathic and homeopathic, but there's not any official ones. You know what I'm saying? The whole way to test is they stick a cotton swab up your nose and under your eye or something, and it's super painful. So they're coming up with better ways to do it. You can do it yourself, but if you test yourself, what am I saying? This is interesting information, but here's some shit that's actually fucking interesting about this. There's mortality data coming in from Italy and from other places around the world. This is super interesting. There's so much data that just comes at you, and you got to sift through it. But check this out. No child under the age of 15 years old has succumbed to the virus in Europe. That means nobody under the age of 15 in Europe has died from the virus. There's one 14-year-old who did, and they were in China. But there's one. Out of all the cases, there's one person that died, and they were in China, and I think that they had a pre-existing medical condition. So, and check this out. If you're in Generation Z, which is me, I don't know about anyone else out there. I'm Generation Z. I'm a Gen Zer. And millennials, less than 1% of all deaths from corona are under the age of 50 years old. I'll say that again, but in a different way. I might make it a little easier to understand. 99%, more than 99% of all the deaths from corona are people 50 years of age and older. Do you like that's the most Hello? That was weird. My Wi-Fi is fine. Do you hear what I'm saying? More than 99% of everyone who has died from COVID-19 is 50 years of age or older. So that means if you're 49 or younger, you are like less than 1% of the people that have died of your age. Which doesn't mean that you're immune. It doesn't mean that, you're never going to get, never going to get it, never going to get symptoms, and never going to die, right? But, it just means that, the people that need to freak out are the people that are way older or have pre-existing health conditions that affect their respiratory system, right? Like if you have cystic fibrosis, or if you have, chronic bronchitis or some sort of respiratory issue, then that's when you are, far more likely to contract the disease. But if you don't have that and you're under the age of 50, for the most part you're chilling. Your odds are pretty good. You can be a carrier, exactly. You're totally right, Trish. You can be a carrier, but the reason it's so dope is you don't have to be afraid. You just have to be smart and stay home so that you don't kill people. Asthma too, that's a good one. But if you're under the age of 50 and you don't have pre-existing medical conditions, which you're blessed and privileged if you don't have to play into the hysteria, and you don't have to be horrified. You don't have to sit at home and freak out. And if you do, you can be super smart and stay home, and you can mitigate the risk of contracting this thing. And if you're under the age of 50, you have a much better chance of fighting it off, even if you do have a pre-existing condition. Stop buying toilet paper. That's true. That's some true shit right there. Let's see. Okay, so here's something for New York, New Jersey, and parts of Long Island. 1 in 1,000 people have COVID, is what they're thinking, which is 5 times what the other areas are seeing. So check this out. In New York, Long Island, parts of Long Island, and New Jersey, 28% of the tests are coming back positive for COVID in New York, Long Island, and New Jersey. 28%, which in other places in America, on average, it's 8%. Are you fucking kidding me? There are so many cases in New York, New Jersey, and parts of Long Island right now. The hot spot in America is absolutely that northeast coast, and that's why you guys got to be so careful. You got to stay inside, only go out for essentials. You know what I'm saying? That is, hey Taylor, what's up? What's poppin'? What's up, Taylor? You got it. You have to be so careful, and it's why it's important to be educated, because in New York, there's 28% of all submitted specimens are positive versus 8% everywhere else in America. Are you kidding me? Be smart. Stay home. Fuck, man. And if you're under 50, stay home because you'll kill other people. You won't even realize it. Casey's dead ass hasn't left her house in 2 weeks. That's what the fuck I'm talking about, bro. I've been locked inside too. Week and a half. Let's go. Carly, check me out though. You're gonna be alright. If you're in New Jersey, you're cool. Just abide by social distancing. Also, if you're in New Jersey and you don't have any pre-existing health conditions and you're under 50, the odds of you perishing are so low, it's not even funny. You there's no reason to freak out. No reason. Yeah, asthmatic patients are at risk, high risk patients, because it has to do with your respiratory system. So if you have asthma, you gotta be super, super careful. All right. Yeah, kids playing basketball in New York, people in South Africa going to public pools. The governors, though, these places are about to crack down. Police are going to be fining and citing people. I don't think they'll be arresting, but they'll be kicking people off of courts real soon, I think. There's no bans on travel in the United States and no plans for that to happen as of right now. But don't fucking travel anywhere if you don't have to, so you know what I'm saying? Dorkeran, you got this. Stay strong, man. You got this. Restez à la maison. Restez à la maison. Restez à la maison. But you guys, Francis, they're smart. You guys already know that. Yo, positive news. You guys want to hear some positive news? So you've been hearing all this talk about how there's like no chance of like there's not a lot of ventilators out and there's not enough ventilators and there are too like not enough beds and stuff. Well, feel me on this. You got two massive boats going to LA and New York right now, and they can house thousands of beds, which is super cool. Here's something super sick too. We were worried about ventilators running out so people can't put a ventilator on if they're having trouble breathing. What they figured out, like yesterday or some shit, that you can use, you remember, anesthesiologists? If you have an anesthesiologist put a mask over your face and you go to sleep for a surgery or something, they can rig an anesthesiologist mask ventilator and turn it into a regular ventilator. So we got like a hella way more amount of ventilators in America than we ever thought we would. So it's like a huge breakthrough. Everybody's super excited about it because there's going to be extra stuff. Dude, FEMA's sending millions of face masks. There's like so many face masks being pumped into the country right now, and they're sending them directly to like places like New York, Washington State, Los Angeles, Louisiana probably, because Louisiana is going to be a hot zone in a second. It's insane, man. Like the United States of America, though we have not even hit the center of our curve yet, because we don't know how bad it's going to get yet. We at least are like doing the work and doing really, really good work too. So keep going. You're staying home. I'm seeing so many people being upset that they're locked at home. You can't tell you how happy that makes me. The fact that everybody's locked at home, not doing shit. Like, are you kidding me? Like, badass, bro. This is us. This is what we're doing right now. Everybody out here, come on, stay home. We're doing so good, and we can do better, and we will do better, because I know you're sick and tired. You're like, I've been home for a week. I've been home for 5 days. I've been home for 2 weeks. And it's like, good, stay home, because finally now you were the first responder. You were the person that got ahead of the curve. Now you got all the other people that weren't taking it seriously. Now they're going to take it seriously. So if you keep taking it seriously, we got new people coming and taking it seriously. That's the majority of people taking it seriously. And guess what? We get ahead of this motherfucker, which is exactly what we're doing. My beard's itchy. I want to make sure I didn't miss anything else, bro. Oh yeah, the federal government is this is really cool too. So like unemployment, right, is a huge issue right now. A lot of people getting laid off from their jobs. If you apply for unemployment insurance, there's not a week period of waiting. If it has to do with COVID-19, you have unemployment insurance. And with that, there comes a lot. There's a grant, too, that was just approved by the United States federal government that, on average, a family household of 4 members will receive $3,000 directly. You get $3,000 on average for a family of 4 from the federal government as part of a package. That's sick. The total right now in the United States. Where's the Maj? What's a Maj? Stasi, what's a Maj? Don't worry, I'm gonna play your boyfriend in a second. I'm gonna play the mayor in a second. 313,000 tests have been completed and delivered back to Americans. So 313,000 tests have been done. Of those 313,000, 41,000 have contracted the virus. So, I don't know what that is. That's like 1/6. Is that like a little more than 10%? I don't know. I don't do math. I'm just an actor. Yeah, alright, sick. So anyway, that's the facts, man. That's from the federal government. I'm going to play the mayor in a second here. I just figured I'd let you guys know. That's what the federal government was saying in the United States. So it's not just LA. Everything else after this point is going to be LA. But this is LA and this is everywhere. If you're under the age of 50, more than 99% of the deaths that are caused from COVID-19 the age group of people that die are 50 years and older, 99%. So that's a tiny percent of people under the age of 50 that have died from this disease. So y'all are so set up. If you're like me, I'm 23, if you're a teenager, you're so set. No one in Europe has succumbed to the virus that's 15 years of age or younger. So if you're under 15, you're scot-free, bro. If you're younger than 15, you're set up unless you have a pre-existing respiratory condition. That's like chronic bronchitis. If you're asthmatic, if you have cystic fibrosis, something like that. In which case, stay inside. No matter what, we should all stay inside, but be super careful if you do have a pre-existing medical condition. This too shall pass. I promise you. You're gonna be all right. You just stay smart. Stay home. All right. Without further ado, it is time for the LA Mayor, Eric Garcetti, Stas's boyfriend, and my future husband, to give us a little bit of an update on the city of Los Angeles. Like I said, I will be here. I'll be right here with you guys, taking notes. I'll do a little briefing after.
Good evening, Los Angeles. A good Monday to each one of you, and thank you again for joining me here for our nightly briefing on this crisis that we all are facing. Let me, as we start a new week, again start with the thank yous to those who did return to work today, those critical workers that are taking care of us in the midst of this crisis, those who are driving the trucks, those who are making the food, those who are checking us out of the grocery stores, and of course our first responders and health officials who are making sure that we can meet this challenge head on. Thank you to all of the folks that are helping with essential businesses keep us in a good place in difficult days. I know we've all been adjusting to our new lives at home, all been adjusting to spending a little bit more time together with each other. But I hope you've found some wonderful silver linings of this gift of time with each other, with our loved ones, with those that are most precious to us, and those that we too often don't have an opportunity to be together with. And thank you to members of the Los Angeles City Government family, disaster service workers, rec and park staff, those of you who have stepped up and who are continuing to serve the city. I'm so very, very proud of you, and thank you for being lifesavers in this life-threatening moment. And thank you to the people of this great city who are staying at home. Thank you for listening last night. I know I had harsh words, and I'll continue to reinforce with folks that you can be a lifesaver, but your actions can also take a life. Keep those 6 feet or more distances from each other, that physical distancing, even as we reach out to each other for social connection and spiritual connection. And for those who still haven't heeded the call to stay home, who are not physically distancing, who crowded beaches and canyons, we know who you are. And this is serious. Stay home and save lives. That's all of our top priority, and it must be yours as well. Saving lives. So tonight, let me update you on the work that we're doing to do just that, to protect your health, to address your housing needs, and to ensure that city operations continue and support everybody in this critical moment. And as always, I give a shout out to everybody else doing this work too. The County Board of Supervisors, my fellow mayors, my city council and other council members, school boards, and so many representatives at the state and national level that are stepping up and playing together than I've ever seen in a way that really makes me feel that we can be on one team in getting through this crisis together. First, let me start with health. As I said last night, ramping up our testing capacity locally and nationally is absolutely critical to our ability to fight and track this virus and ultimately to defeat it. We will continue fighting tooth and nail to bring more testing kits and resources to Los Angeles, working with the county, state, and federal governments, with our private sector healthcare partners, with universities and public labs, with anybody who can help. But we're not sitting still. Yesterday, you heard me talk about the online portal that we launched, where people at the highest risk can find information about 4 new testing locations run by our city. So far, the first day, we saw great progress. The website is up and running. It didn't crash. It's functioning as planned. And about 780 people, probably more by the time I'm speaking now, signed up and got tested today. On top of that, we've tested more than 325 of our leaders on the front lines: first responders, critical city workers, healthcare professionals, those working with the homeless, and others. And we're going to keep expanding that testing capacity till we have that capacity to test even more and more people every single day. And I want to thank our county supervisors. I want to thank Councilmember David Rue and others who are working on this puzzle together. We really are on one team, and we're going to open up that aperture to as many different folks for testing as possible in the days ahead. If you feel that you might meet the criteria for a test for COVID-19 today, please go to coronavirus.lacity.org. For another day, this is just for the zip codes in the city of LA, but we hope by the end of the week to be able to open that up to folks throughout the county as well, and we're working closely with our county board of supervisors and other cities to accomplish just that. These tests, again, are for the most vulnerable Angelenos, those with symptoms, who are 65 and older, have underlying health conditions, or both. And no matter what, we will have the ability to continue testing our frontline workers. We know we are going to depend more than ever on our doctors, our nurses, our medical assistants, and others who keep our hospitals, our clinics, and our healthcare infrastructure going. So we want to ensure they can continue doing their essential jobs, as well as those firefighters, police officers who are on the front line. There's nothing more vital than preventing the spread of this virus, keeping people healthy, and saving lives. That's what we're focused on, and that's what these tests will provide. Second, let me bring you up to speed on what we're doing to keep everyone housed. As small businesses face an uncertain future and many workers grapple with under or unemployment, I'm committed to making sure that nobody loses their homes during this crisis, during this period as a result of the coronavirus. That's why today I'm enacting an emergency order prohibiting the removal of any residential rental units from the rental market under the Ellis Act, and imposing a moratorium on Ellis Act-related evictions in the city through this crisis. This action closes a gap in the eviction moratorium that we had put forward earlier and clarifies that this special class of evictions is also prohibited. This step is necessary to protect additional tenants from being displaced from their homes at the exact same moment we're asking them to stay at home. And as a reminder, if you cannot pay rent as the direct result of this emergency, you cannot be evicted. And this applies to both residential and commercial tenants. But I want to be clear, the money you owe won't disappear. After this emergency ends, you will have 6 months to pay it back. And it's important to remember that everyone is struggling right now. Not all property owners are large companies, and many get by on the month-to-month checks that they collect. So if you can pay your rent, you should. I also spoke last week about our efforts to house unhoused Angelenos. And I won't mince words, this virus will hit our homeless community hard. It's not a question of if, but when. With the county, with fellow cities, with Judge Carter, who's working now in the city of LA and the county of LA, we are all running around looking at ways that we can do that as quickly as possible. And I want you to know that when the moment arrives that we see folks who are unhoused on the streets, we have to be prepared to respond quickly when they get COVID-19 to save their lives. We haven't been waiting. As I mentioned, we have over 310 sanitation stations for folks to wash their hands and sanitize their hands. We're putting out a record number of bathrooms, porta potties for folks to be able to use, continuing street